Hello everyone, I am Dr. Abhinav, consultant dermatologist and hair transplant surgeon, Eugenics Hair Sciences and Eudermis Skin Sciences. Today I will be discussing a very important topic called hair transplant. So a lot of people in India and all over the world are undergoing hair transplant, but with advancement and you can say mushrooming of clinics, people are confused how to choose a right doctor or how to choose the right clinic. So today I will guide you on this topic. So I'll tell you what are the criteria which a clinic or a doctor should fulfill before you come to a judgment that he is the right person from where you can get your surgery done. The two types of degrees, or you can say two types of doctors are eligible for doing hair transplant in the world. Number one is MD dermatologist and second is MCH plastic surgery. So dermatology is one field in which hair transplant is one of its branches. So someone who is having a MCI recognized degree in India like MD, DVD, DNB, he's eligible for or DDVL is eligible to do hair transplant in India. Second thing, a plastic surgeon, an MCH plastic surgery person. So he is qualified to do surgery on skin. That's it. So number one is qualification. Second thing, how frequently he is doing the surgery. So someone who is doing a surgery say once in a month or once in say 2 months or once in 15 days will not be able to deliver excellent result compared to a surgeon who is doing on a daily basis. So because it's a surgery of hand-eye coordination. So if my surgery will become more and more finer if I do it on a daily basis, and I will give more artistic and you can say natural results. So you have to see in that clinic or in doctor how frequently he is doing that surgery. So that will ensure great results. Third thing which I want to stress is the technique. There are two types of technique, FUT and FUE. These are grossly, and the third technique is direct hair transplantation. So fourth one more which I want to add is robotic hair transplant. Robotic hair transplant in India, virtually no one is doing, because it's in the robot we right now makes only, you can say, it does the extraction process. It doesn't do the implantation, it doesn't make the slits, it doesn't do hairline designing. The first is FUT. FUT was you can say one of the oldest procedure. Before that there was one thing called punch grafting. So in FUT surgery you take out a strip, so there's a linear scar at the back, right? So there's a limitation. You can take out a maximum of 2000 to maximum of 3000 grafts from the back. That depends on the head size. If the head is narrow, maybe 2000 grafts. Head is wide, maybe 3000 grafts. So that limits you can say number of grafts in one surgery. So someone who is bald from here to here, so he may need 6000 from, so maybe 2000. So only FUT he may be able to cover this much only. So he cannot cover the crown. That thing. So FUE is possible to extract maybe from the same size skull maybe 4000 grafts from there. That depends on the efficiency of the surgeon. Surgeon A, which may be able to take out only 2000, a surgeon B may be able to take out 2500 without damaging the aesthetics of the donor. Second thing, ability to take out beard grafts. So in FUE or DHT, direct hair transplantation, you can take out beard graft as well. Beard, you cannot take a strip from the beard, right? So FUE surgery you can take out the beard, and DHT you can take out the beard. So this is the thing. So you should know the technique we are adopting. So in second thing, there is no scar in FUE surgery. In FUT there is a scar, right? So you can get a second surgery after this surgery from the same donor area. You can crew cut your hair in FUE, but you cannot do that in FUT because there is a linear scar at the back. Point number 3 is, you can say, you can say the research of the doctor, whether he has published paper, he has written some books, whether he is qualified, whether he is attending the latest in hair transplant. You have to read, you have to research about the doctor. Fifth is patient reviews. So it's not just about Google reviews or things which you have reading on his website. You should read on the third-party platform, Hair Transplant Network, Google reviews. You can say the Facebook opinion. You should meet actually patients who have got hair transplant done from them, or you should get their phone numbers and talk to them. Not one, at least 10. Point number 6, you should be able to ensure that he is using international level of instruments. Now why instruments matters? Because instrument will determine the cost of surgery. So you may be seeing a lot of ads in which people are throwing freebies like PRP, 6 PRP free sessions with the hair transplant. That will not determine your result. What will determine your result? The experience of the surgeon, the expertise of the team. So how many surgeries the team has done. So I may have done one surgery, but my team has done 500 surgery. So I may be able to deliver an average result. But if I have done 500 surgery and my team has done 10 surgeries, I may not be able to deliver at all, because it's a team work. I may be able to extract the graft, I may draw the hairline, I may make the slits. But the team has to plant, the team has to extract after I do the scoring of the grafts, punching of the grafts. So you have to understand, it's a team work. The experience of team is of utmost importance. Another point which I want to see is the type of instruments. Now people think that from clinic A, he's offering the surgery at this price say maybe 25,000 for a certain number of grafts, 50,000 for a certain number, and clinic B is charging 1 lakh plus. So why is there a difference? So you have to understand there are 3 things. Number 1 is the experience of the doctor. Second thing is the experience of the team. More the experience, more the salary, right? If you get surgery done and say with a very famous cardiologist, he may charge a certain amount of money, right? And from a very young cardiologist, he may charge lesser. So experience matters. That is even more important when you are doing very big surgery where your whole head is bald, right? Because in which even a wastage of 10 grafts is criminal. 10 grafts is criminal. So you have to understand that. Then the type of instruments, magnification. So there are things called Carl Zeiss loops. There is something called plastic 2x loops. The Carl Zeiss loops provide magnification even up to 8x. So more the magnification, more the precision of the surgery. So it's a microsurgery. So if you have more precision, the grafts will not be damaged. So whatever you plant will grow. It's not how much you plant, it's how much you grow which matters, right? Another point which I want to stress is the type of instruments. So there are international level instruments, there are local instruments which are made in India. So higher the quality of instrument, less is the damage in the donor area. Less is the damage. If I can take out say 3,000 grafts from this area, that is only possible without giving a visible scar if I use international quality instruments. So someone who is like Anupam Kher, like you can say totally bald from here to here, he needs each and every graft is important. He cannot afford wastage. So if you get a low cost surgery done from some place, so he may take out 2,000 grafts, but he may damage another 500. So that 500 would have used in the next surgery so that will be only known when he gets the second surgery done. So that is there. Then you have to see whether his results are consistent or not. If you go to a clinic, he may show you 1 result, 2 results, but they should have consistency in the results. That will only you will come to know when you read about them, research about them, meet few patients. So price should come at the last while choosing a clinic, not the first criteria. Because if you're choosing a clinic with low cost and he damages your graft, supposing out of 3,000 I'm seeing only 1,000 grow, that 2,000 will never come back. That 2,000 grafts will never come back. So even if you go to the best doctor in the world in the US, then also he may not able to give those grafts. So choose a surgeon based on experience, choose a clinic based on its performance, read about it on different forums, and price should be one of the criteria. Yes, you should go ask them to give you the best deal, right? But that should not be the only criteria, because your grafts are limited and your donor is big. The wall is very, very big and the paint is very less. So that's why that's what I want to tell you all, guys. So it's very important. Don't go after free buys, don't go after cheap gimmicks, don't go after newspaper ad. Do the research, read about the doctors, read about his qualification, see the setup, see the instrumentations which are using, meet his patients, or at least call these patients and don't meet only one, meet at least 10, and then decide about the clinic and the surgeon, because it's an aesthetic thing. It's not about growing the hair, it's about growing it in a natural way so that no one can say that you have got a hair transplant. That's all. Thank you. Hope we'll meet again and you like my video.